Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. Welcome to today's episode of The Golden Hour. I'm your host, Dr. O, and I am joined by a dear old friend and renowned certified nurse midwife, Alyse Nikolao. Alyse studied English literature and language at USC, and then she completed her master's in nursing and dual focus in midwifery and family practice at Vanderbilt. She's now working as a midwife at a large hospital-based practice in the Pacific Northwest, where she lives with her wonderful husband, Jason, her 4 kids, and the newest addition to their family, a new bernedoodle puppy. Welcome, Alyse.
Thank you. Thanks for having me.
We just started talking about, before we started recording, about that sweet little bernedoodle. What's your dog's name?
His name is Fitu, which is, 7, because he's the 7th member of our family.
Yeah, perfect. And is Fitu especially attached to you? Is that why you were saying that if you headed out of the room?
A little bit.
Yeah. Is he brand new?
He's pretty new. He was born in June. And so we've had him for maybe a month.
Yeah. Are the kids doing a good job of sharing parental duties? Or
my daughter's really good. He probably likes her the best of all of us. So she's very responsible.
Yeah, I know. So of the 4 kids, give me the rankings.
Yeah. Justice is 13. Amaya is 6th grade, 11. Just started in middle school.
Yeah.
Bo is 7 and Losi is in kindergarten. He's 5. Yeah.
Yeah. Okay. So but Maya's the one who really is in charge.
That's right.
Does she rule the siblings as well? Does it work out that
definitely.
way?
Yep.
I think it's like the first of daughter thing.
Yep.
I think so. It seems inherent. Well, I'm so glad to have your time, especially knowing not only how busy you are in your practice, but 4 kids and a brand new bernedoodle. Your time is precious. But one of the reasons why I was so excited to have you on this podcast is because, as a midwife, especially as a midwife who also did dual training in family practice, and just I know a bit about you personally, knowing that your brother was a dear friend of mine since college. Just even thinking about your family at large, your culture, I imagine you have such a rich experience and just insights. And so this is our time to chat about it. I think it's going to be great.
Great.
And so really starting off, what made you decide to, pursue your dual program in midwifery and family practice? Where did that come from for you?
Yeah, I used to want to be a large animal vet. I was obsessed with horses, and that was like the dream. And my mom kept trying to get me into like a vet clinic to volunteer or to observe, and the liability was so terrible she couldn't. And she always made the joke that it was easier to get me into a hospital, into an OR with humans, than it was to get me into a vet clinic. So I kind of was very young, and I think I watched a gallbladder removal surgery at 6th grade or something. I can't remember. But that was sort of the start of it. And then fast forward to being 15, I was the oldest of 7 kids at the time. And my parents always talked about 7 being the number of completion and how they weren't having more kids. And all of a sudden my mom was pregnant with her 8th baby. And I was a self-absorbed teenager who just thought that was terrible. And it's very funny thinking back now. But anyway, she, instead of yelling at me for being a self-absorbed teenager, she invited me into her prenatal care, and I went to her appointments. And we lived in a super small town and got to know that OB pretty well. And the last appointment, I remember he asked me to leave, which was weird because I had been there for everything. And when I stepped out, he asked my mom permission to get my hands dirty and asked if I could whatever. She's like, I didn't even know what that meant.
Yeah.
And she, of course, it was her 8th kid. So she said, yeah, whatever. And so then when she came during labor, he took me with him. He got me scrubs. I did the full, I was in full gown and gloves. The nurses all thought I was a med student because I looked a little bit older. And so they didn't know who I was. He honestly stood behind me with his arms folded and let me attend the birth, which is, I can't, even when dad's helping with birth, I still usually have my hands right. What he let me do now, thinking back, is absolutely crazy. He did step in and like did a quick swipe just to see if there was a cord, I remember. But
Yeah.
other than that, he really just said like, it's really slippery. Don't drop the baby. So that was 15. And after that, I knew I was going to do some type of birth
Wow.
work.
Yeah.
So I did, yeah. So I did pre-med and pre-nursing prereqs and still like was really unsure. I really love writing. So I always knew I wasn't going to major in biology or I was just going to do prereqs. So I went to USC, and when I found that dual program, it felt like a perfect way to do what I wanted to do and have a lot of
Mm.
flexibility and get into practice quickly. Yeah. So I ended up at Vanderbilt doing that. And yeah, that's the
Yeah.
long answer to the simple question.
No, that's an amazing story. I mean,
Yeah.
this is my first time hearing this story, and
Yeah.
I think it's so incredible imagining that OB had the foresight, if you will, to even just like get you involved and help you transition from being like this teenager's like, oh my God, mom, like another sibling for me to like help you out with and care for, to being like fully like
Yeah.
hands dirty, if you will,
Yeah.
and delivering your one of your own siblings, which
Yeah.
is insane. That's
Yeah.
so beautiful.
Yeah. I remember telling her this, this kid is going to be 2 when I leave the house, or 3. And like, this kid isn't going to know me. I'm going to have no connection. So it's
Yeah.
really sweet because now it's like seeing a nice, sweet connection that I like caught her.
Yeah.
Yeah.
Yeah. Oh my God. I had
You
no
didn't
idea. That
know.
is so, I had no, it's so special.
Yeah.
I'm a little jealous even though it's just so special. Cause you're right. Whenever, dads very kindly like ask if they can help deliver the baby, I'm still really there. I'm like basically hands on hands. Yeah. But to some degree, your OB probably was just like, and this is, your mom's 8th delivery. It's
True.
going to be okay.
Yeah.
So,
Yeah.
wow, that's amazing. That's probably one of the best, like why I ended up in the birth space stories I've heard. I think you win.
It made for a good admissions essay,
Yeah, right? No,
Yeah.
totally. I would have let you into any and all programs. And so fast forwarding now, how do you feel like, that dual program of family practice and midwifery, is that something that's integrated into your work now? Are you doing primarily OB work? Do you also do like general family practice care?
Yeah, I do almost no family practice care, mostly because of the setup of our clinic.
Yeah.
In a perfect world, I would love to figure out a way to blend that a little bit more. And I think that was always the dream, was to somehow be seeing families. But my first job out of school was at a private family practice, and I did a little bit of primary care, a little bit of medical weight loss, and a little bit of OB. So I got a little bit of everything. But it's really challenging. So I did that for about 4 or 5 years, and then felt like I really wanted to just focus on OB for a while. So I've been doing that.
Yeah, I think that's our happy space, right?
Yeah.
There's something so beautiful about getting your hands dirty. We get our hands dirty each and every day.
Yep.
And so tell me more about, the practice that you're in, and what about, being a midwife fills your cup up? Yeah,
I have a really great practice. I actually had baby number 4 there, and then it was so wonderful. I ended up going and working there. So it's a big hospital, but we actually have a birth center connected by a sky bridge. So our patients who don't risk out and qualify and want kind of a more out of hospital birth experience can do classes and consent to delivering at the birth center. And we have nitrous there, we have water birth, we have a whole bunch of just and we have doulas and nurses who also are kind of in alignment with that kind of birth space. So it's a really nice thing for me because I get to have that experience, which feels like a birth center, but also if we need to call NICU or need an OR, we're like a Skybridge drive away. So I feel really lucky because I feel like I'm getting good birth center experience without actually working at a birth center. And then I'm still getting to first assist, and we still have patients who have the option to have a totally medical birth and have an epidural or do whatever. Or if people just kind of risk out of the birth center, we can still attend their births at the hospital. So it's a really nice balance. I feel like I get a really big variety. And because we're so busy, we also have 12-hour call shifts, which is kind of unheard of. And we always have 2 midwives on at once. So it's a nice, like, collaborative team environment too.
Yeah, that's pretty special. I mean, one, having that birth center that's adjacent to the hospital, I think, I've done all of my training and all of my work so far in the Bay Area, but we don't have something like that. And I think that it is really fortunate for those patients. There's a spectrum of how you can give birth, right? That's the beauty of birth, and that there are patients who opt to do it at home. There's patients who opt to do it at the birth center. There are patients who either medically need to or choose to have it in a hospital setting. And so to have something that's kind of like a hybrid where there's a little bit of a flex space is actually pretty unique. Really I'm like, nice. Should I work there?
Yes, please come.
And for those who are listening who maybe don't necessarily never heard of a birth center or understand what that is, can you kind of explain in your own words what that is and how that compares to the different settings that you can give birth in?
Yeah, there's a lot of like out of hospital birth centers that they're really lovely, and they're oftentimes there's kind of a spectrum of different types of midwives that work there. They're not always certified nurse midwives. Sometimes there's like professional midwives and certified midwives. So there's some different kinds of education and training and licensure. And at those places, they often have kind of a more comprehensive prenatal care, newborn care, sometimes even family practice. The hard part is, and oftentimes you're getting all of your care, including labor and delivery, in the same space, which is really nice for patients. The hard thing is if someone either risks out or needs to transfer to a hospital for some reason, a lot of times those separate facilities, that means an ambulance ride. Oftentimes it means a transfer of care to a stranger, to a whole different team. So when it's the right place for the right patient and everything goes great, they can be a really lovely place to deliver. I think for us, it's such a gift to have everything in one space, because if we transfer, we're maintaining continuity of care, and oftentimes, it's a much smoother experience if a patient needs to transfer.
Yeah. No, I definitely agree, and I get, even hearing you, so much of this podcast is I think solution driven, where I want to create a space where either birthers or those of us who work in the birth space can like talk candidly about the things that we're doing well and the things that that we can do better. And so even hearing this concept of a birth center that's adjacent to a hospital, I feel like that should be the standard of how labor and delivery units are built going forward. Because I think there are just, again, so many different ways to give birth, and we should, we owe it to our patients to honor that the best that we can.
Yes. And I think it casts a bigger net for people, because I think a lot of times partners aren't always on exactly the same page in terms of comfort for a birth setting. So I think a lot of times it feels like a really good alternative to like a home birth, because sometimes, not everyone views that the same way. And so this is a way to feel like you have a space and a setting that really does feel like you're, like looks like a hotel room. There's just a normal bed, a normal dresser that's hiding all the equipment. And then like a big, all of our, even like our newborn resuscitation stuff is all kind of tucked away. So you wouldn't actually know there was anything medical. So it has that feel. So for a lot of people, it's just like, it's a nice alternative with a really strong safety net.
Yeah. And really to make it really simple in terms of, you described like how the layout looks more, like a hotel room, something that kind of feels more cozy, if you will, less medicalized. And are there certain things that are not offered at birth centers versus hospitals? So like, would a birth center patient be able to get an epidural? Would a birth center patient, are these patients who are having a labor augmented or not? What about those options?
Yeah. I mean, all birth centers have kind of different criteria for, for ours, anything that risks a baby out of continuous monitoring risks them out of the birth center, because we are just following kind of like intermittent Dopplering protocols. So any epidural, any augmentation, any like medical augmentation. So we'll do like sometimes like a breast pump or something, but anything medicine that risks the patient out. We'll still do some IV pain medication, but obviously for like an epidural, that would be continuous monitoring too.
Yeah.
We still do GBS treatment there, and we do have nitrous, that patients can do nitrous there.
Yeah, that's great. No, it really does seem like it's like there's like a stepward fashion in terms of, okay, for me as a patient, as a client, I know I really want to try to have birth experience that is a little less hands off. I'll put that in quotes.
Mm-hmm.
Understand that my hands as an obstetrician are oftentimes the hands involved, and I feel honored to do the job that I do, but I recognize for some patients they want to, they don't necessarily need that, let alone want that. So it really does sound like it's a really nice middle ground, but also understanding, what I love about working in the birthing space is that 99% of the time it is incredibly happy and joyous and just a true celebration. But I also, why I have so much respect for not only the bodies we care for, but the people in the space like you and I, we're also very prepared for the fact that, gosh, things can change very quickly. And we really, part of what I try to assure patients about, especially, whenever I have a recent call, I was on call, I had a really busy call this past Thursday night of kind of really talking to patients about how part of our training as the nurses, the anesthesiologists, midwives, doctors, etc., your whole team is also ready that if something happens, like we will do things very quickly for you and your baby. And so sounds like you guys are also in that, a great setup where if something unfortunately does happen, it's, quick access to be able to get a patient over to the hospital facility if needed. Hopefully not, but if needed. Do you see your own outpatient prenatal patients?
Yes. We don't have like a strict panel that only we see. So we are pretty team based, but a lot of people appreciate a familiar face that they can get to know. So most of the time we're trying to see most of our patients, but since we have a shared call, a lot of times at the end, people want to try and at least meet a few different faces.
Yeah, same here. And with your prenatal patients, how or do you at all find that you're counseling them about like the different spaces they can birth in? Do you feel like because your practice is this large hospital that has both a birth center and the hospital space, patients come in decided? Are you counseling them at all in those appointments? How does that go?
Yeah, well, just like you said, that you don't have something similar to that in San Francisco. I think because it is a pretty unique place, we do attract a lot of patients who know about our birth center. And then it's for people who aren't aware of it, it is a part of those prenatal visits where we start just having a conversation about what people are hoping their birth plan looks like. And not everyone wants that type of birth. So some people are very, very sure about wanting an epidural, and then that makes it really easy to know which place they're going to deliver.
Yeah, that makes total sense. Okay, I'm going to make it a little bit more personal.
Okay.
You have I love learning that the number 7 means like perfection and completion for you and your family, because now I understand where that sweet little bernedoodle came in to bring you guys to 7. But for your human children, tell me about your birth experiences with your 4 kiddos and where did you birth? Did you birth in the hospital, the birth center, at home?
My kids almost followed the normal pattern. So I like the first normal long took forever. I delivered at Stanford, got an epidural, had a wonderful anesthesiologist I could have kissed and had
Oh my God.
And then my second was very much a second baby, barely made it in the door of the ER and she just like came out screaming.
Yeah.
And that was during midwifery school. So I think I was much more prepared and just like stayed home maybe a little too long. But we lived really close. So he just came rip roaring out in the ED, never even barely made it into the room. And then classic third baby who my water broke and I did acupuncture and massage and pressure points and I was trying everything. And finally at 24 hours had to go in for Pitocin. That was sweet Bo. And so I got to experience Pitocin, which was, a little bit harder than the ER baby that fell out.
Yes. I'm sure.
Yes. And then sweet Losi is who I delivered at the birth center. And I knew it was going to be my last baby. So we had a lot of family there. It was really sweet. And Amaya, my daughter, was there. And I have this sweet picture of her like on a rocking chair. Just like, it was fun.
Oh, yeah. Look at you. I mean, I always say this and it comes from a place of love, but I always say that when you get up to like 4 kids, you're just kind of showing off, like in that you're like, hey, me and Jason, we have our act together. We know, we're organized enough to like take on a near basketball team. But even hearing you, I honestly actually reflect and just tenderly appreciate that you actually had like the spectrum of birth experiences.
Well, actually, I have to be totally honest. The truth is, I actually had a 5th baby. Do you know about this? Did Caroline tell you? My sweet sister-in-law and my brother-in-law. So Jason's brother and his wife are dearly close friends. And when we lived in Portland, got really close with my kids. They were wonderful aunts and uncles. And then we were pregnant together when I was pregnant with my 4th and had a really sad miscarriage. And she had 1 embryo left. And so I told her, if you find someone younger and healthier who wants to carry through you take them up on it. But if not, I'll carry this. I'll try. I'll do my best. Because at that point I was, pushing 40s. I also got the IVF experience, which was something. So I had a 5th baby for them and did IVF and had everyone talk. I mean, I should have been very aware of, I had a lot of people talking about how I looked and how big I looked or how small I looked. And I had this shift that I worked and I was just like so tired of everyone talking about my size. So I called MFM and I said, can I just do a growth ultrasound today? So it was like during my call shift, I ran over, got a growth ultrasound. I was 35 weeks and he was measuring fine. Like, I think he was 6 pounds or something. And so I was like, okay, I'm going to stop stressing about this. He's going to be fine. I'm not too big or too small. And then I got off work and I was going to exercise and I decided not to. And I'm so thankful. So I went and laid on the couch and then my water broke at 35 weeks and I felt terrible. And I was like, my job was to cook this baby full term. So I felt bad that I was like preterm now and I had to go back into the hospital. And then did steroids, got Pitocin. It was fine. And he weighed 7 pounds at 35 weeks. So I was very thankful that I got out of jail early for that kid. So that was
girl.
my story.
Girl, oh my God. See, this is why you're here. This is why you're on the podcast. You literally, you have personally, you have experienced it all. I literally can like make an episode out of each of your birth stories at this point. I do think, I say this often, I think the baby is in charge. Like whenever like patients are having these like, longer inductions or they're trying to understand, I'm 40 weeks and 5 days, when this baby coming, I think they just know. So I'm imagining this like well-grown 7 pound, 35 weeker who's just like, pop, it's time.
He went home in 24 hours. They didn't even keep him extra at all. So it worked out very well.
I'm happy for them. And I also just appreciate though that there really is, what you ended up doing for your brother-in-law is, surrogacy is really in of itself like a very like it's a physical process, but it's also a giving process. How was that for you? Emotionally, physically?
Yeah, it was so important. And I'm glad that I had the foresight to know that I shouldn't even consider it until I was done having babies. I think it would have felt really different if I was not done. And I wanted to know that like all my kids were here. I was done having my babies and that making this easier. Cause it was just like, kind of like a prolonged babysitting. With the unfortunate, progesterone shots. That was the worst. When I hit 13 weeks, I was so thankful.
I'm done. Throw away all the syringes. No more.
Yeah, that was hard.
Yeah. But it's also, that's a special way to kind of, show your love and support for people that you really care about too, right? Yeah. So I can imagine what you mean to them and their family. So that's so beautiful. Yeah. So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB/GYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so it can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Well, you really have truly experienced it all. I think I was chuckling when you talked about the third baby, because the third babies are always like this wild card.
Wild card, I know.
My second babies, they know what to do. They know to just come out as quickly as possible. Hopefully not in a car, like maybe, like it sounds like you just stepped into the ER. But the third babies are, and do you find that third baby kind of wild card, does it correlate with a personality at all?
Yeah, probably. Yeah. I think so.
Yeah. It's so interesting.
Tabitha, so we should.
Oh, yeah. Okay. So that's really interesting now too. I'm like, perspective. All right. Well, you have obviously your own rich experience with what you do in this unique kind of birth center, hospital hybrid space. You also have had, a total of 5 pregnancies, each of which is so unique. And something that I personally, have really found special in my friendship with your brother Tavita is acknowledging, this big family that you are a part of, your culture as a Samoan woman. Has that, and does that ever play into the way that you approach birth, family, either at work or in your own personal life?
Yeah, I think that there is a lot of unfortunate reality about being a person of color having a baby today in this country. And so I think any level of compassion and awareness and sensitivity and advocacy for people who look like me, I think is important. And I think in terms of both nursing and midwifery, it's also true. Like there are not a lot of midwives of color. We don't have a lot of Black midwives. We don't have a lot of Polynesian, Samoan, so it feels important partly just to give patients the opportunity to have someone taking care of them who looks more like them, and also to be just aware of what it looks like to give compassionate care.
Yeah. I obviously, or maybe not so obviously, have an awareness of kind of the movements within the space of obstetricians around, diversity, inclusion, et cetera. What are the conversations like amongst, the bigger midwifery groups, whether it's the associations, the conferences that you guys have? Are there conversations happening?
Yeah, I think there's a lot of conversations happening. I'm probably not the best person to answer that because I've not been, it's been such a weird time and space with COVID and conferences and meetings. So I've definitely not done the best job in this busy season of my life, but it's certainly,
okay. You're a busy girl.
Yeah, certainly a goal for the future because I think there is a lot of work being done. Yeah.
And when I think about supporting birthers and those that choose to create families and grow families, I find that I reflect on my own, my family in that space. My husband and I have yet to start our own personal family, but I think about, my mom was the oldest of 8. I have, I think, at least 40 cousins on my mom's side alone. I think Tivi and I often compare notes of whose family's bigger. And so talking about kind of that richness and that, that love, that chaos, all of that seems to be intertwined in some way. How does that kind of influence the work that you do, or does it have an influence at all for you?
Yeah, mostly it just is such a reminder of all that we have to be thankful for. When you do birth work, you see the full spectrum of what it looks like to have a baby or want a baby and not be able to, or get pregnant when you weren't planning it, or just have a really hard pregnancy. And yeah, I think it gives me a whole bunch of gratitude for my own birth experiences and our families. I've had the privilege. I've been to all but one of all my sister-in-law's births, and none of my sisters, which is terrible. But yeah, I feel really grateful for all the grandbabies, all the cousins.
Yeah. I know you are you're like the family midwife slash doula. Yeah. One of the reasons I even had like the honor of inviting you onto the podcast is that, Caroline, your sister-in-law,
Yeah.
Shared with me, how immense your support was for her. How does it feel when you get like tagged in by family to support them? Do you feel like an added pressure? Does it feel rewarding to you? Like, what is it? What?
Yeah, it's such a privilege. It's such a sacred
Yeah.
space to be invited in. And especially when I consider that those are all sister-in-laws, not even my, it's not even my blood relatives or whatever. But yeah, it's just a privilege, and feel thankful. And it's partly just because life is busy and our plate is very full. And my own story includes having a kid who got really sick and is now like total care and needs a lot. I think being able to show up for my family in that way feels really special.
Mm-hmm. Mm-hmm. Yeah, no, I can only imagine. That's why I'm even surprised and honored that you're even doing this podcast with me, and that I know that you're incredibly busy, not in just like the routine, like I've got errands to run. You guys have a kind of a full scope of people to love and things to do and bernedoodles to walk and all of the above. When we take it back to your, clinical space, I think a lot of, again, why I did this podcast is feeling like patients come into that office visit with a lot of joy, a lot of hopefulness, but also like a lot of anxiety and fear of the unknowns.
Yeah.
How do you meet patients in that space? How do you approach, the very appropriate levels of anxiety or fear that our patients have?
Yeah, it's a good question. I think I'm pretty blunt. I'm not like, I think there's a stereotype about midwives being really kind of crunchy granola or really, really like soft and caring. And it's funny because I don't necessarily see myself that way. I'm definitely a little more type A and blunt. So I think I'm really big into just being as transparent as I can, because I think I build trust with people that way, where they know if I think something, I'm going to tell them. And especially when it comes to how a patient's feeling or what a patient's anxious about, I ask that question a lot. Like, what can we talk about that will reduce your anxiety? What can I do that's going to give you a little bit of peace? What are you someone, or even what helps you with anxiety? Like, do you need information, or do you just need someone to listen to you? Or do you just need me to tell you to take a Unisom and get a good night's sleep? So it's like, I think I'm really direct.
Yeah. I like that approach. And I appreciate you saying that there's many different flavors of midwives, right? That there is this concept of maybe, and I'm using a lot of like, random adjectives, but like crunchy, granola, soft, and gooey. But I think there's, so many different ways to approach it. I always like to say, because I also think on the opposite end, sometimes patients, have like a little bit of a doctor. Like, I don't want a doctor involved because there is unfortunately, like this bad rep of like doctors have a tendency to over medicalize birth, and we were trying to like push Pitocin on everyone and all these things that aren't really true. And so I always counter that to say, well, I was trained by midwives, like in my residency, like when you learned all of your normal birth from midwives. And so I always want to say that I'm somewhat of a hybrid, but yeah, I think there's so many different ways to support patients. And I really love your approach of understanding basically what they need, right? There's some patients who just want the facts. They want information, and so they can take that information and feel empowered by that. There's some patients who just like want to be able to have a place to like vent. And there's some patients who need something in the middle. Really, I think those of us who have the honor of being in the birth space, the first step is like listening and understanding what this person needs from me and meeting them there.
Yeah.
Yeah. Yeah. And when you think about midwifery care large, do you think that there is like a space for where it can improve, a space for it? We talked about how it can improve in terms of diversity. Everything can improve in terms of space of diversity.
I know.
Sadly. But are there other big either movements or things that you think that we can do better for our patients?
Yeah. Yeah, I think you kind of touched on it when you were just talking about the limitations of kind of our work day. And I think that's true for midwives, especially I think a lot of certified nurse midwives are working in similar kind of setups where you never have enough time and you're seeing a lot of patients in the day and you're maybe seeing someone twice postpartum also. I mean, that definitely resonates with me. I just did a new OB appointment and the other day, and when we at the very end just did a quick question about mental health, it was like, oh, I don't think I ever even got over postpartum depression. And we had, and it's just such a reminder that there's so much opportunity for us to do better in even as a country and how we're supporting families, and we're one piece of that. But I think all the ways that we can extend the time and the face time that and the resources that families have during pregnancy and after feels very similar to what you were talking about.
Yeah, no, I mean, I think most of us who, again, have the honor of working in the birthing space, at least in the capacity that we do, so more, hospital-based clinic space where, we have limited appointment times, limited appointment numbers of sessions. I think we all a lot of us feel similarly constricted. I think I fantasize about other countries where it seems like, these are just my theories because obviously I only live and practice here, but there are other countries that seem to kind of prioritize families in different ways. So I think about countries like Germany or Finland or, different European nations where moms have a year of maternity leave. And we had good friends who gave birth to both of their children in Berlin, Germany, and they had like a midwife who did home visits for the first couple of weeks. And, childcare is paid for, and all these things that really puts families first in a way that sadly our nation doesn't do, and so often feels like that not only do clinicians feel like they're a little bit bounded in healthcare and what insurances reimburse and this and that, but also just nationally how we support those who start families that at a policy level are things that need to move and change.
Yeah.
And so this podcast sometimes for me is like a venting sesh where I can feel validated in my feelings. Yeah. And just feeling hopeful that whether it's conversations like this that keep happening, that eventually, they get to the ears of those who really have the power to move the needle. Because we can just do better. We can do so much better. Yeah. Well, as someone who, again, not only at this point has probably worked with countless thousands of birthers, but also has had her own, 5 very unique, very special birthing experiences, what words of advice would you give someone who's either preparing for pregnancy, is pregnant, maybe in the throes of postpartum where you're like, gosh, so tired and overwhelmed? What would you say to someone in that space?
Yeah. That's such a good question. There's so many things. What is the one thing?
You could say multiple things.
Can I say multiple things? I mean,
yeah, please.
The first thing that comes to my mind is just the power of community and relationship, and which is in opposition to isolation, which isolation can be so damaging when you're feeling like no one knows or no one understands or no one cares. So I think that is true, during pregnancy and after, that all the things that we can do to make sure people have community and people are known and supported feels like so important, because I want people to feel like they have the support that they need. And that's not just trusting clinicians, but it's in all the areas of life. And And sometimes that can be such an important first step when someone's willing to, have a conversation about all the complex, hard things that are the birth space.
Yeah.
Yeah.
I agree. I think it's come up a lot in other podcast episodes so far, but this concept of the village, that traditionally when we gave birth, we were surrounded by aunties and cousins and, other, village members who are right around the corner. And so we saw birth many times before we gave birth. We attended births. We, watched people that we loved breastfeed. And now, just in the nature of society, we are naturally a little bit more isolated.
I know.
You leave the hospital surrounded by, a great birthing team, nurses and all these lactation support. And then you come home and it's you and the baby and hopefully a support person or two, but it can still feel so jarring.
Yeah.
And so really just like relying on that village, bringing all those people in, making sure that they hear your voice. And when you need them, and knowing that you need them way more than you think.
Yes. And it's such a vulnerable space. I mean, pregnancy can be vulnerable, birth is vulnerable, and postpartum is just like so challenging that, none of those feel like the most opportune time to try and build a community. So I think it just has to be part of life.
Yeah. Agreed. You said you had other things that you wanted to advise. What are the other things that you're thinking about? I
mean, I have a lot of people who show up and say things like, just like aren't sure. And so I'm always, we have such a wealth of information, and sometimes too much. I have some interesting things that people are learning on, TikTok.
on TikTok, I always say this: Dr. Google and Nurse TikTok are my arch nemesis.
Oh my goodness!
I'm like, where'd you get that piece of information?
Yeah. TikTok is interesting. Someone asked me if they could, if I would just give them Benadryl instead of an epidural at the hospital, and they heard that on TikTok, and I said, sure, I'll give you Benadryl.
Yeah. It probably won't work the same, but why not? But yeah, you were saying.
Yeah, just the more that patients can, have self-awareness for what, even when we're talking about like birth plans, and that's even more true when we're talking about family and parenting, just starting with knowing who you are and what's important to you. I'm always trying to bring people back to that when they're asking me about vaccines or about family visiting, and what if their aunt won't get the flu shot, or there's tons of examples, and I'm always bringing patients back to, welcome to parenting. This is going to be your first chance where you get to decide what you all believe and what your core values are. And then you have to make your decisions in alignment with that. And you're also going to have to live in this hard tension of, sometimes you're going to have to set a boundary and protect this space and protect your kid. And sometimes you're going to have to say, hey, the benefit of you getting to watch your family love on your kid is worth, maybe you're going to get a cold. And there's no perfect answer. And so I think I'm always like making that joke to patients when they want me to tell them exactly, what I think they should do, that they just empower people to like decide what they believe in and then make their decisions accordingly, but to not lose sight of, again, power of relationship and community, because that is the most, I always tell people, I think it's the most surprising thing when I had kids, that I always, you hear all the time, oh, you're going to love your kid more than you ever knew. It's, like, you hear that all the time. What I didn't hear or think about was what it was going to be like to watch all of these people in my life, who of course I love, but to watch them like build a relationship and love on my kid and see this new like mutual thing, that was flooring to me. And I don't ever want other people to miss out on that because they're worried about whatever. And of course, that's just like one example, but
no, that is so powerful. I think that, we often talk about like that instantaneous moment when baby enters the world, the people in that birth space, in that birthing room all of our lives change, and that ripple effect, especially for, you know, the immediate family. But then you think about the aunties and the uncles and the cousins and the neighbors and all those people who are developing relationships with your baby. That is really special. That is really special. I really do think of like that. Every singular birth is like truly like this ripple effect, because that person didn't exist a moment before, and now that person exists, and there are going to be an infinite amount of people somehow directly or indirectly touched by that person. So that's such a beautiful reminder. And I love how you counsel patients. I think, as I told you even before we started recording this podcast interview, I'm doing this podcast for many reasons. One of my selfish reasons is to like talk to other people in this space and learn from you, and honestly steal the things that you say. So like even the way that you kind of reflected that question back to to your patients, like it's true. There's so many well-intentioned, very appropriately anxiety ridden questions that we get, because it feels like there's a yes or no answer, and there's one of those answers is like the best answer, and it's not true. Nothing is better than the other. It's really about your own personal set point and your value judgment, and, you know, as you weigh the risks and benefits, what weighs, you know, heaviest for you, then that's what should drive you. That's what's going to make you feel safer. That's what's going to make you feel good. Than empowering your patients to make that decision. So yeah, I love that. I love that approach. Anything else in your wisdom as a multi-birther and a midwife that you'd like to share?
I don't think so. I don't know.
Yeah.
I don't think.
I'm curious. It's probably unfair, but I'll make this unfair assumption that sometimes, you know, because we are in this space and, you know, we spent all this time learning it, and then also caring for patients, some people maybe unfairly assume like, oh, okay, well, pregnancy must have been so easy for you, or labor, you probably like had already like thought all through all your positions, and postpartum, you know, maybe you really had anticipated the things that would maybe hard. So you had your workforce of support built up. How was it in reality for you? Like, again, being as knowledgeable and experienced as you were, how was it in real time with your pregnancies and postpartum? I heard about your cool labor stories, but did you feel like it was just as hard as you'd imagine? Did you feel like there were things that caught you by surprise?
So it's interesting because my first birth was before I trained as a midwife. So I got a really good kind of pre and post education and training. And I remember being so terrified with my first that I was gonna, and I think I'm a little controlling. And you know, you hear so much about, there's culturally so many things that you see and hear and watch about women like in labor. And I was so afraid that I was going to be out of control and that I was going to turn into this crazy person and that I wasn't going to recognize that person. And I completely, I like told my husband not to tell me what to do. Very much stripped him of anything that he could have that would have been helpful for me, because I just remember being so worried about turning into a monster, which was unfair, and it gave him no power and no tools, and it was a terrible setup. Luckily, the epidural worked very well, and it was fine. But then, you know, with after training and after more marriage and probably being a little more, you know, mature, but also just then the confidence of like, oh, I am not going to turn into a crazy person. And being able to like invite people into your birth space and give them power and jobs and even just connection in ways that I could, like, letting him support me was so helpful. And then like I told you with that last birth, it was fun to have more family there. I think I had, Amaya was there, some siblings and their partners and dear friends were there. So it was a party. I
was going to say, like, I'm trying to count how many people do you think were in that room?
The rooms are huge. I told you it was really nice. So, but I think that was what you reminded me with your question is, I think it was part of the driver of carrying that baby for my sister-in-law was knowing I was pretty lucky. I had good births. I had good pregnancies. And I also know what hard feels like. I know when, like, having my son when he got sick, that was devastating. And remembering the feeling of like being in the absolute most pain I've ever been in, and also being like the most loved and supported at the same time is just like such a crazy thing.
Mm-hmm.
And watching other people deal with fertility stuff, and that
Mm-hmm.
fertility wasn't my story. That wasn't my thing. And it just felt like such an opportunity to be able to show up for someone in something that was hard for them, and knowing and having the personal experience of like, I know what hard feels like, and this is something that I can do. That being a big driver of Jason and I deciding that we were going to do the IVF thing with them. So I think the flip side of that, and answer to your question, is just a lot of gratitude, because I did have, I had, when you do birth work and you can see the things that can be hard, it makes you grateful when things go smooth.
Yeah, no, that's so beautiful. Hearing you, I often think about a world that is something of balance.
Mm-hmm.
That someone's really hard could be your like relatively easy, and vice versa. Like when I think about my partnership with my husband, or dynamics at work where like my midwife colleague who I'm on call with is probably way better suited for that patient who has like a birth plan that looks a little bit more crunchy granola, or like has been pushing for 6 hours, but we're trying to figure out like different pushing positions to help flip the OP baby. All these things are like, wow, I wish I learned that in school, but I didn't, but you did. Like everything is balanced. So even your ability to again, a very like selflessly carry a pregnancy for your sister-in-law, because you knew that it was easy for your body. That is like the ultimate balance that you brought into that dynamic, into the world. Yeah, that's so special. Pregnancy and birth wise, it sounded like those were relatively easy for you. What was if anything?
Maybe I don't know if I'd say easy, but
easy.
But definitely,
yes. So Alyse is like smooth. Yes, I honestly I shame on me for ever saying that, because I don't think you can say that with anything in relation to conception, pregnancy, labor. None of that is easy. But say smooth. Yes, okay. Smooth is a better term. Thank you. I stand corrected. Anything about your postpartum experiences as someone who again has endured 4 postpartum experiences for your own kiddos? Any kind of words of wisdom or insights there?
Yeah. I mean, I sound so repetitive, but the community thing is so big. You've met my mom. So lucky that, it is her time to shine. She is so good at the postpartum period. She's like an angel. She just bops around the kitchen, and she's like bringing water and holding babies, and she's just an actual angel from heaven. So I'm really fortunate that I had so much in the way of support with all of my family, and especially Grammy. I did have one of my babies. It was, I think, Bo. I think after my third, I went back to work really fast and was like not feeling good. I was tired, and I just thought it was, life and work and baby. And one of my coworkers finally just said, "Have you checked your thyroid?" I was like, "No, it's just postpartum." I'm just like, I checked my thyroid, and my TSH was 64.
Girl. Just for patients who are listening, like a normal TSH is supposed to be less than 4. So 64 is insane.
It's insane. I remember getting on medicine and hearing my alarm go off and being like, that is what it's supposed to feel like when you wake up. So that was probably my most difficult postpartum. And I think I was probably in very bad shape.
So this speaks to just how, I think you're a badass for many reasons, but how badass you are. You're like, God, I kind of feel crappy, but I'll keep going. Meanwhile, your body's like, help me. Like,
it's terrible. I've only seen like 2 people have it high since then.
I think you're the high. I think you win. I'm like trying to think of the numbers I've seen. I think that's my personal highest. Wow. Well, that was incredible.
A little rough.
Yeah. Well, as I already said, even at the beginning of our chat, but I'll say again, I'm so grateful for your time You're a wealth of knowledge, not only just in your experience as a nurse midwife, but also as a person who's birthed multiple times, who supported people that they love in such a unique and special way, and someone who like shows up with their patients in a really honest but heartfelt way too. I think that you've inspired me, you've encouraged me in terms of my own personal approach. I hope and know that those listening will likely take away several kind of points of reflection and inspiration. And so, Alyse, we thank you. I thank you for your time.
Welcome. Thanks for having
for your
me.
honesty.
And thanks for the work that you're doing. We need more people doing these kind of conversations.
Just trying to get the word out one podcast at a time.
I love it.
But yeah, you are seriously amazing. I feel so honored that, goodness, was it 15 years ago, I found your brother to be at college. We became friends. And now, as Kismet would have it, you and I both are in the birthing space and can, support each other in the own ways that we can. So thank you for lending your time and joining me today.
Yes, you're so welcome. And you let me know when you want to come work over here.
That place
you come work with me.
Amazing. You and I could be like a dynamic duo. Like, seriously.
I love it.
I'm gonna get off this podcast.
Get a lot of work done.
I'm gonna talk to my husband about how he feels about the Pacific Northwest.
Great.
I think I can sell him on it.
A trip.
All right, my dear. I really appreciate you. Thank you again.
Yeah. Take care.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.